During this skills assessment, we will be setting up a sterile field in preparation for wound care, assessing wound and surrounding skin, and doing a dry dressing. So of course we're starting off with hand hygiene. This is just a short clip to show you that I did it. And then after that, we're going to put on some gloves. I say before you start anything, you should always ask your patient how they're doing, if they're comfortable, and if they need to use the washroom at all. When preparing your sterile field, you should always remember surgical asepsis. You should have your table waist high because anything below your waist is considered contaminated. You also want to have your area set up so you're not facing the back of the patient. The dressing trays come with a perforated edge, which allows you to open the package without contaminating it. Once you remove the sterile tray from the package, place it down away from you and gather the little piece and pull away. Remember to only touch about 1 inch around the edge of the sterile field. This is now contaminated. The edge of the contamination is a good place to place the forceps on the area you touched the forceps with. This stops with contamination and allows you to continue with your sterile field. Inside the sterile tray, we have a sterile drape that we'll use to extend our clean field. So I will lift it off the tray, step back, and drop, keeping the forceps facing down. Then I'll grab the garbage bag, step back, and do the same. So now I'm just going to grab my garbage bag and I'm going to unwrap it. This is just going to help me have somewhere I can put all my sterile stuff when it is now contaminated. So once I open it, I'm just going to unravel it. And here's me showing you how I'm going to tape it down. And now I'm going to just pour some solution into the sterile field. So here we have a sterile drape that will be used to extend our clean field. This is not sterile anymore. This is just extending an area which is clean for our patient while we do the dressing. So here's me just putting it underneath his foot. So here I am just assessing the foot, pretend there's no toes there. The wound is located on the right foot, measures to be about 11 centimeters. The wound is inflamed with expanding redness around the area. Yellow cloudy wound drainage is present along with tenderness and pain. Foul odor occurs and a sign of infection is present. So I've sped this part of the video up just a little bit because it was just a little bit long, but here I am going in with my forceps and I'm just taking these little sterile pieces of gauze kind of type stuff and I'm just dipping it in the saline solution and wringing it out. Here I am wringing it out and now I'm just folding it up from the corners and then I'm going to grab it. And I'm using this motion and I'm just using one swipe from cleanest to dirtiest and throwing it out. And now I'm going to repeat the process again until the area is completely clean. The way I like to think about it is one wipe, one way, and discard. And you can see that's what I'm doing here. So now I'm just taking a piece of the dry ones and I'm going to go around and do one wipe, one way, and discard with the dry just to dry it all up. So now I am taking the 4x4 pad and I'm just opening it, making sure that it's the pad, and I'm just dumping it right on the sterile field. This way it is still sterile and it's not contaminated. And then I'm going ahead and picking it up with my forceps and putting it on his foot. Now I'm going in with the abdominal pad and I'm just trying to open it. And this, you don't have to actually grab it with the forceps. You can grab it on the blue piece. I know I contaminated it right there if you've seen it, but I didn't have another abdominal pad, so I just kept going. Now I'm just using tape and I'm window taping around the toes. So now I am taking my gloves off and about to perform proper hygiene after I clean my sterile field. And here we go.